I'm excited to share how I think about nutrition for POTS and hear your thoughts on it. I have POTS myself with pretty severe orthostatic intolerance. This picture is of me enjoying acro yoga, one of my favorite activities because I'm really high functioning just so long as I don't have to be upright too long. So thanks for understanding if I change positions sometimes while we talk. My plan today is to first humbly acknowledge that nutrition research doesn't have the best track record for getting things right the first time, even when it has a big body of research. You know this if you were conflicted about whether to eat eggs this morning. So in POTS, we only have a few studies to go on, so let's think of this as still early thinking and best guesses on POTS nutrition. So after that, I'll share nutrition strategies and findings for POTS. Then I'll quickly summarize a few diets or findings that can maybe help POTS patients, but the research was not done on the POTS population yet. And I distinguish nutrition for POTS from nutrition for POTS patients. I think they are very different. To me, nutrition for POTS is just a few very small, simple, easy tips that patients can layer onto whatever diet they're already doing. And in my experience, every POTS patient quickly learns most of them, probably on the very first day they even know they have POTS, because patients make them into internet memes and funny t-shirts and awareness bracelets like these shown here. So I've never actually had a patient pay me to tell them about nutrition for POTS. They already know it, and they've already done it by the time they call me. But this is in contrast to nutrition for POTS patients, which is anything but simple and straightforward and easy. For starters, the average patient has over a dozen different symptoms. These are the most common ones with their prevalences in parentheses. Nausea or vomiting was reported by 82%. Abdominal pain was in 70% of patients. Lightheadedness, even just sitting, was reported by 64%. So we're not off to a very good start for most patients even being able to enjoy a meal here. And other symptoms like dizziness, fatigue, headache make it harder for patients to go grocery shopping or to cook or clean up. And many of these symptoms get worse after eating for many people. So nutrition can be a challenge even before you add in patients' comorbid conditions. The sheer number of them is the main point here. The ones on the left affect the GI system and so have a big impact on eating in one way or another. And those listed on the right are the ones not focused on the GI system, but can still affect nutrition needs or ability to eat, like mast cell activation disorder. That's not on the GI side, but sure can have a lot of GI symptoms. And it's not important to understand all of these comorbidities. My point is to say that the authors of this article from the Mayo Clinic are thinking what I'm thinking, which is it's almost never just POTS. If those patients with just POTS exist, I'm sure they do, but I don't see them. So the comorbid conditions I'm discussing most with POTS patients are mast cell activation syndrome, autoimmune conditions, irritable bowel syndrome, and gut motility problems. And many patients have more than just one comorbidity alongside their POTS. So I don't think I'm exaggerating to say that POTS patients can have a combinatorial explosion of complexity. But the good news is that more issues means more opportunities to potentially help somewhere, somehow with nutrition. Because POTS has some nice nutrition strategies to try, but not that many. We'll cover them, and you might wonder, okay, is that all a POTS patient can do? But the good news is that every other circle on this diagram, which represents common symptoms and comorbidities, and it's not exhaustive, but all of them have their own set of nutrition findings or strategies around them. Not tested on POTS patients, but often with a better, bigger body of research than what we have around POTS, and often replicated in a lot of different populations, so we can hope to find something that might apply to us POTSies too. For example, the diets for autoimmunity and MCAS may be particular opportunities since some experts think POTS can be caused by autoimmunity or MCAS in some cases. And to be clear, I'm not saying nutrition can cure any of these issues, but I think it can move the needle on quite a few of them. And in my experience with the complex patients and as a complex patient myself, even a 5 to 10% improvement can sometimes actually be pretty meaningful. We know how to take that energy and use it to work toward the next 5 to 10% improvement. For example, with exercise tolerance, we know that when POTS patients can exercise regularly, they usually really improve their POTS. But many POTS patients can't do that exercise to begin with. So if we could just improve exercise tolerance just enough to get an exercise routine viable, maybe there's a virtuous cycle to be had there. So that is the POTS nutrition that I get excited about. So if we start with just POTS, the first nutrition opportunity is low blood volume. The average adult has about 5 liters of blood, but about 70% of POTS patients are thought to be hypovolemic or lacking blood volume. In a study of 13 patients by Dr. Raj and team, the mean blood volume deficit was about 12.5%, or about a third of a liter of blood. And that didn't sound like a lot to me. I thought, a third of a liter, would I really notice that? But according to Dr. Raj and team, their paper says that represents a moderate to severe hypovolemia. So that's thought to contribute to many POTS symptoms, especially when upright, and it's thought to occur because some hormones, some kidney hormones, are making us flush out too much salt. And the fluids always follow the salt. So the strategy to address this is extra salt and fluids. The 2019 expert consensus was to gradually work toward 2 to 3 liters of water per day and up to 8 to 10 grams of salt per day. And some experts also recommend drinking up to half of the fluids from electrolyte drinks if someone's POTS is really severe. All fluids are found to be hydrating except for alcohol, which can be a triple whammy to POTS patients because it's a diuretic, a vasodilator, and a mast cell trigger. Patients have to test their own reaction to caffeine. Some love it for the energy and vasoconstriction. Some feel way too jittery. Front-loading the drinks makes sense to avoid nighttime bathroom trips. The sports nutrition literature shows that chugging the first 2 cups can help promote a faster boost to blood volume, and lots of patients like doing this before they even get out of bed in the morning. 8 to 10 grams salt is about 2 teaspoons or 4,000 milligrams sodium. It's not that crazy much for patients who can eat pretty normally, given that the average U.S. consumer eats 3,200 milligrams sodium per day. I mean, they're not supposed to eat that much, but they do. And Dr. Satish Raj's labs have done 2 great studies on this. In the most recent, they had 14 POTS patients and 13 healthy controls come into a residential eating facility twice for 1 week each time, about a month apart. So all of their food was provided for them. 1 week, they were given an almost 0 sodium diet. Then on the different week, they did it again with a very high sodium diet. I believe that diet had about 17 grams salt per day. In POTS patients, the high dietary sodium intake increased their plasma volume, which got about halfway back to normal on average. It lowered standing plasma norepinephrine, that's that hyperadrenergic state, and it decreased standing heart rate. So it definitely helped their POTS somewhat, but it did not get them all the way back to normal. But remember that was going from almost 0 salt to 17 grams, whereas the average POTS patient will be going from their baseline, maybe 5-6 grams, up to a maximum recommended of 10 grams. So we don't expect miracles, but patients sure seem to feel like this helps them a lot. There seem to be a few misconceptions, though, that can be unhealthy. The first one is when patients think that they're supposed to drink as much water as possible. About once a week, I speak to a patient who tells me that they feel more dizzy when they drink, and that's when my alarm bells for hyponatremia go off. and I'll ask how much they're drinking, and sometimes it is a lot. The record is 14 liters of water a day in a woman who was still trying to do more because the more dizzy she felt, presumably from hyponatremia, the more she thought her POTS was acting up. So too much water without enough salt can go to the brain and cause all kinds of swelling and symptoms, and in extreme cases, even death. So I like to make sure that patients know the goal is 2 to 3 liters of fluids, not as much as possible. The number 2 misunderstanding is the same thing from the other side. Since you need to consume water and salt in proportion, sometimes it can also get unhealthy if a patient is doing tons of water, but they decide to skip the salt because they think it's unhealthy. Number 3 is a common mistake, thinking that salt and sodium are the same thing. Salt is sodium chloride and actually only contains 40% sodium by weight. Food labels state sodium levels, but POTS recommendations are usually given in salt levels, so patients have to do a little math there. And even some of the very top institutions have this backwards on their websites for POTS. They say for patients to consume up to 10 grams of sodium, which is 25 grams of salt, and that would be 5 teaspoons, or way too much. So the last one is surprisingly common, especially in teenagers in my experience, and it might be wishful thinking, but when they're told to eat salty foods, they think that means forget the broccoli and the chicken and the apples and replace it with pretzels and chips. It doesn't always occur to them to just shake salt on top of healthy foods, so it cannot hurt to make that clear to people. So a few notes about electrolyte drinks. Ideally, we'd avoid artificial sweeteners, especially aspartame and sucralose, because they're bad for gut microbial health, mood, maybe even some cancer risk it's looking like. Propel is a really common one with artificial sweeteners. So, if someone is having mast cell reactions or allergic reactions to all kinds of electrolyte drinks, one likely culprit is the citric acid that's in many of them. It turns out that 80% of the world's citric acid, I'm not joking, is made by mutant strains of toxic black mold. And the citric acid is molecularly identical to that from a lemon or a lime. But if there's a bit of contamination and you get fragments of the mold in your food, then it's documented to be able to cause some pretty bad inflammatory or allergic type reactions. Food colorings have been shown to exacerbate ADHD in some studies, so homemade recipes can be found online, and it's nice to save the money and avoid artificial ingredients. It's also nice not to drink out of plastic bottles. If you get the powdered drinks and mix them yourself, then you can also avoid the plastic bottles and drinking BPA or other bisphenols, which are unhealthy for a lot of reasons, but a big one for POTS patients is autoimmunity. Dr. Blichstein's 2016, I think it was, paper showed POTS patients are at higher risk already of autoimmunity. And this paper at the bottom by Dr. Datis Karazian shows literally 12 different mechanisms by which BPA in plastics is thought to promote autoimmunity. So there's no upside to consuming plastic. Might as well try to minimize it. So that covers hydration. The next most common issue in POTS is excessive blood pooling in the abdominal area, the splanchnic area, which is made even worse by eating. So this is thought to be why so many POTS patients are exacerbated by meals. So studies show that everyone's heart rate goes up after meals. It's just that probably most people don't notice it as much as POTSies. A full-size meal is shown to triple the amount of blood flow to the GI organs, and carbohydrates do it more than proteins or fats. So, to avoid making the brain and the stomach compete quite so much for a POTSi's limited blood supply, the solution is thought to be smaller, lower-carb meals. Some patients also like to lie down for 30 minutes after meals. Waist-high compression stockings might theoretically help, and I personally like to lie on my stomach while I eat. The next issue is glucose intolerance. After ingesting carbohydrates, a healthy body raises insulin to escort that glucose into the muscle cells, where it can be burned or stored. Insulin resistance is when cells don't respond to that insulin, and so they don't let in the glucose. At that point, the pancreas will at first put out extra insulin to overcome the resistance, but over time, if this continues, the blood sugar may not be able to enter the cells, driving up blood sugar and setting the stage for type 2 diabetes and all the issues that come with that. So usually we see insulin resistance and prediabetes and type 2 diabetes in people who are overweight. 90% are overweight. But when Dr. Shabow's lab at Vanderbilt University did a glucose challenge in POTS patients, where they drink a bunch of yucky glucosey liquid, she found that their insulin was twice as high as controls who were matched for age, gender, and size after 2 hours. Lean POTS patients had the insulin response of obese people. So that's one more reason to reduce carbohydrates. And nobody's really talking about this yet, but maybe POTSies should also start getting their hemoglobin A1C levels tested younger than other people. I don't know if we should be thinking about preventing type 2 diabetes in POTS patients. One of the POTScast episodes goes a little bit deeper into this, and I talk about more things you can do about that. But the next issue is gluten intolerance. In one study, 100 POTS patients were tested for celiac disease and compared to the general population. 4% of POTS patients had celiac disease versus a background rate of only 1%. When it came to self-reported gluten sensitivity, 42% of POTS patients had it versus only 19% among controls who were matched for age and sex. The authors said they did the study because their POTS patients kept telling them how much better they felt gluten-free. We were hearing the exact same thing at dysautonomia clinic, so we did a survey of 20 POTS patients who had on their own already gone gluten-free for at least 4 weeks. And we just wanted to know, okay, you keep telling us you feel better off gluten, but how exactly do you feel better? Which symptoms improve and how much? So we gave them the Compass 31 survey of autonomic symptoms, which asks about orthostatic intolerance, vasomotor, GI, pupilomotor, secretomotor, and bladder symptoms. The subjects took the survey once for how they felt back when they used to eat gluten. They did it by memory. And then they took it again for how they feel now that they're gluten-free. And we were pretty impressed with the responses. These are the 20 subjects' total Compass 31 scores before and after gluten-free diet, with the mean scores on the far right. Every single patient except one had improvement in their autonomic symptoms. Some improved by a lot, as you can see. There are some where, there's 20, 30, 40, 50% improvement. And then when we looked at the autonomic symptom subcategories, you see statistically significant improvement in 3 categories: orthostatic intolerance, vasomotor symptoms, and GI symptoms, plus the overall score. On top of that, the mean self-reported improvement in POTS symptoms was 45%. That's not a typo, 45%. That blew us away. Now, granted, this was not a random sample of POTS patients. We could have found 20 POTS patients who would say they feel worse on a gluten-free diet. These were POTS patients who had, on their own, decided to go gluten-free, but we were still amazed at their reported effect sizes. So why would a gluten-free diet help POTS? Well, We don't know, but gluten is known to increase intestinal permeability, which can be a big driver of inflammation and autoimmunity because it means that more of whatever is in your intestines, and that includes things like bacteria, undigested food particles, pesticides, whatever, can find its way into your bloodstream with who knows what result. Studies also show that antibodies to gluten can cross-react with several different brain tissues. Interestingly, some studies have shown that only 1/3 of gluten symptoms are GI symptoms, and that the other 2/3 are neurological. Now, unfortunately, a low gluten diet doesn't really do much. This is one diet where you really need to do it almost 100% to see results. And it takes some serious vigilance because, for example, an independent lab found that 50% of menu items at restaurants claiming to be gluten-free actually were not. So it's a pain. They're also finding that some people are genetically predisposed to something called a gluteomorphin reaction, and that's when your brain has literally been making opioids from gluten. So you have a real opioid withdrawal response when you give up gluten, and I suspect that accounts for some of the people who swear that they need gluten to feel good. But for people with bad constipation or slow gut motility, getting off gluten may potentially help because of that opioid effect. They would just have to ride out a week or two of withdrawal symptoms. Gluten is not the only thing in wheat that can trigger an immune response or cause problems. So we're saying gluten, but really people might be reacting to other things in wheat. And finally, the United States is famous for having the most triggering wheat. Some people, if they don't have true celiac disease, just a gluten sensitivity, do report that they can enjoy wheat from other places like Italy or Japan where it's grown differently. And this is kind of a known thing. So some people who really care but want to keep their gluten products just order it from other countries. But moving on to nutrient deficiencies in POTS, this study looked at 24 adolescents with POTS and found much higher prevalence of low iron storage and mild anemia compared to the background rate in the U.S. pediatric population. The only thing is they defined adolescent POTS as a 30 beat per minute increase in heart rate upon tilt instead of a 40 beat per minute increase, which is the standard now. So I don't really know what to do with that, but just so you know. Vitamin D3 is a common deficiency, and this was just an N of 1 case study of a patient whose POTS went away when her doctors figured out that her body was not converting vitamin D3 into the active usable form. So she started supplementing with activated D3, and she was pretty much all better. In this study, Dr. Blitzstein explains how although thiamine deficiency is rare, it can cause a lot of POTS symptoms. So she measured thiamine levels in 65 consecutive POTS patients and found 4 who were low in thiamine. They all supplemented with 100 milligrams a day, and 1 saw enormous fast improvements. So now at Dysautonomia Clinic, we're on guard for that, and I believe that Dr. Blitzstein has had a few other patients improve hugely on thiamine supplements. So unless you have absorption issues or are an alcoholic or a vegan who just also doesn't eat grains or legumes, it's theoretically hard to be deficient, but good to keep an eye out for. Vitamin B6 has no studies on POTS, but anecdotally, I keep hearing multiple physicians comment that their POTS patients have weirdly high B6 levels even when they don't supplement. B6 is associated with peripheral neuropathy when it's either too high or too low, so that's a little interesting to me. Energy drinks and bars can have a lot of added B6, so maybe that's where people are getting it. I don't know, I just tossed that out there. This study found lower B12 levels in POTS patients. However, The authors are from Turkey, and they defined POTS as fainting on a tilt table test versus not fainting. So I don't know what that really means for POTS, but fainters had lower B12. And interestingly, they found no difference in iron levels, so that goes against our earlier study on the adolescents. So there's no more actual research, as far as I'm aware, on POTS and nutrients per se, but Dr. Blichstein did this wonderful presentation on vitamin deficiencies and POTS at the DI conference a couple years ago. It's online if you search for it, so I highly recommend that. So to summarize POTS nutrition strategies, they are to increase salt and fluids, to try smaller, lower carb meals, to test reactions to gluten, dairy, caffeine, alcohol, and other things, and to be vigilant for nutrient imbalances. And I see these helping people a lot. My only beef with them is that they don't specify anything about still trying to eat real, unprocessed foods. You could satisfy this list while eating what I call the standard American POTSy diet, as long as those pretzels were gluten-free, right? It would tick all the boxes. And I talked to a lot of POTS patients eating this way. In fact, some even believe that when their doctor said to eat small, salty meals, they thought they were supposed to snack on this stuff all day instead of the, regular whole, chicken and broccoli meals or whatever that they used to eat. But even without this misunderstanding, it can be really tough with POTS to get real, whole, balanced, unprocessed foods that are convenient enough. Pretty often, it's tough to cook or even want regular meals. So here are some food ideas that are quick, easy to cook, easy to clean up. And I realize that people with gastroparesis or difficulty chewing or swallowing will have trouble with these, so I have another slide coming up for them. Protein, veggies, fruits, nuts, seeds are all great ideas. Hummus can be a quick way to get proteins and healthy fats and low glycemic carbs without much effort. Hummus plus pre-chopped veggies can be a super quick way to hit all the bases, or guacamole and chopped veggies. Frozen stir fries are my favorite because they come in 1,000 different combinations, and you can just put them in a skillet for 10 minutes. You can do that every night. But if even these things take too much standing or effort, then some real convenience options include some of these. And I know I keep showing veggies and protein because I think those are the harder things to get. I think that starches, dairy, and fruit are easier to come by, so I'm not really dwelling on those as much, but those are great choices also. There are a few brands out there, such as Amy's or Dr. Prager's, which have really healthy veggie and protein options that just need heating. And this picture on the lower right is something that you might recognize if you have Trader Joe's. They have over 30 different prepared salads, or things like the just chicken or just salmon or just shrimp, all ready to go. And they have all kinds of good frozen meals. The main thing at Trader Joe's is finding a time when the lines aren't long, maybe early in the morning. I realize that many POTS patients cannot eat that much fiber or quantity, but I am always amazed by how the literature seems to imply that all POTS patients are underweight and unable to eat, but I hear from many who are overweight and have big appetites, and they really can eat a good-sized meal. So I think there's some of each. But some patients really could never eat this much bulk or fiber. So for them, obviously homemade foods are wonderful. And if someone's willing to make you a homemade soup and then strain out the fiber, that's amazing. But there's lots of convenience products like these that can also work. So pre-made soups, drinks, and baby food for people who cannot stomach solid food for whatever reason. Like maybe they can't chew because they have trigeminal neuralgia or TMJ, or they worry about swallowing, or sometimes with gastroparesis, they need to be on liquids. Baby food is sometimes a difficult mental hurdle for patients, but boy, is it ever convenient if you need small, handy, pureed meals. Plus, of course, you can find all different types. You can find it organic or gluten-free or low FODMAP, whatever your dietary issue is. So I do encourage people to think about them when they can't really stomach solid food. A couple other ideas are the nut milks, like almond milk, cashew milk, hemp milk, or the drinkable yogurts, because it's a way to drink some calories without having it be just sugar, like juice would be. And then the Kate Farms drinks are specially formulated to be complete nutrition, and they're trying to be a little bit healthier than, like, say, the Boost, for example. So that's a medical product. And obviously homemade fresh items are ideal, but realistically, these are some of the better convenience foods when people need liquid or pureed things. So that's all I've got about the just POTS. But since some findings suggest that POTS maybe can have an autoimmune basis, let's take a quick look at autoimmune diets. They generally are built on research findings about how to fight chronic inflammation. So they try to optimize gut health by having foods to prevent or avoid dysbiosis. They try to maximize gut microbial diversity because we know more diversity is associated with fewer health problems, and also more diversity helps to send signals to the immune system to be more permissive and laid back. And then the third part of gut health is avoiding leaky gut, or that intestinal barrier integrity that if it lets too much stuff into the bloodstream, it can lead to problems. The autoimmune diets also try to stabilize blood sugar because blood sugar swings can lead to inflammation and immune responses. A big one is to identify and avoid any immune triggers. And for autoimmune patients, that might be things like gluten or dairy or dietary lectins, or a lot of foods have proteins that are just similar enough to gluten that if they have a gluten problem, they will cross-react. And there's a few other foods that tend to be more commonly inflammatory to autoimmune patients. So generally there is an elimination diet phase where you try to take them away, see if you feel better, reintroduce them, see if you feel worse, and then if you identify some, you avoid your triggers. Then they also just try to provide loads of nutrients, especially those known to be anti-inflammatory, like the colorful plants and the omega-3s, things like that, plenty of vitamin D. And then avoiding anything that causes inflammation. And the big one here is industrial additives. So oftentimes that would be things like plastics or other things that are in the food supply that are not really food. So the most well-researched autoimmune diet is the Wahls protocol. And the diet looks like this. So look at all those servings of veggies on the bottom, right? All that fiber feeds the friendly gut microbes, plus the colorful plants are all very anti-inflammatory. And I think this was the first diet to break out veggies into multiple other food groups to make sure people don't just eat the same one every night and call it good. But working up the pyramid, this diet cares about the source and the quality of the animal protein, and that's a whole nother topic, but factory farmed meat is getting some pretty ugly research findings lately. For example, because the pesticides from the animal feed can work their way up into the meat, the fats are different depending on the diet of the animal, the antibiotics in the farmed animals are suspected to kill some of our friendly gut microbes and other things like that. So moving up, the grain is gluten-free for the reasons I mentioned earlier. And then this diet excludes gluten, processed foods, eggs, dairy, and sugar because they tend to be more inflammatory to people with autoimmune conditions. But some people are able to add back in eggs and dairy if they don't react. This is a very strict version of an autoimmune diet, but many people do a much lighter version where maybe they just give up sugar and gluten and try to eat a lot of natural foods, especially veggies. So you could imagine combining this with the POTS nutrition strategies, and plenty of people do that. Another diet that many POTS patients try is the low histamine diet for mast cell activation syndrome. Some MCAS researchers think POTS can be directly caused by MCAS, so a 3-week trial of this diet could be worth a try for some POTS patients. In this diet, the aim is to identify and avoid triggers. That's always the first priority. And I just remind people that it's not always the food. I think people are too quick to blame their food when they have a reaction, when it could also be other things like drugs or supplements or pollen or mold or who knows what. So I just want to lobby to not overly blame the food. But the next step is to reduce dietary histamines by limiting non-fresh foods, and I'll cover that more in a minute. Next, you can help stabilize mast cells with flavonoid-rich foods, which are colorful plant foods. Next, you can avoid amplifying any mast cell inflammation with anti-inflammatory foods. So again, more colorful plant foods and omega-3s and a few other things. And then finally, you can avoid blocking DAO, diamine oxidase, the main enzyme for breaking down histamines. And the way you do that is by, unfortunately, limiting everyone's favorite drinks, coffee, tea, and alcohol. So, foods high in histamines include anything that is aged, cured, canned, dried, or processed. The meats can really become the histamine bombs if they're not so fresh. Anything overripe or mature, including refrigerated leftovers. Seafood tends to be higher in histamine, especially shellfish. There are a few brands of seafood where they promise that the minute they catch that fish, they gut it and freeze it, and those tend to be lower histamine. Fermented foods are high in histamine, aged cheese. Now, some weird exceptions, even fresh tomatoes, fresh eggplant, and fresh spinach can be high in histamines. Then alcoholic beverages. Now, these are the ones that are consistently high in histamines. When it gets down to some of the details, a lot of the lists of high histamine foods disagree. So, what do meals actually look like on a low histamine diet for MCAS? Well, it's a whole lot of very fresh or frozen animal proteins like chicken, turkey, red meat, or fish. Eggs are good, but you want to cook them thoroughly. If you have runny egg whites, those are high histamine. You can do fresh or frozen vegetables, except for the spinach, eggplant, and tomato. Fresh or frozen fruits are good, except citrus. I've not seen good data on this, but there's kind of a feeling that citrus fruits are histamine liberators. So some people don't do well with those. Other good choices are whole grains, sweet potatoes, yams, some of the more fresh dairy, not the aged, but like the mozzarella cheese, fresh stuff. Some of the dairy substitutes are good, like almond milk. And then for cooking or fats, olive oil and coconut oil are liked. And pets love this diet because everything you eat needs to be fresh, and leftovers often do not work. So this diet is super inconvenient for humans, but it is a dream for dogs. I try to focus on the positive. So these are some common MCAS supplements, which I won't get into, but one thing about the low histamine diet is that it's very inconvenient because everything needs to be fresh. It's very frustrating because you can't always control how fresh things are, especially at restaurants or other people's homes. And worst of all, the different lists of compatible foods all disagree. So you get conflicting information. So at the end of the day, this diet involves a ton of detective work, and each patient has to find what works for them. Even non-edible triggers can raise your histamine level and make you tolerate fewer histamines. So on a day where there's wildfire smoke or you're having a lot of stress, you might find that foods that are normally low enough histamine for you are not. So basically, this diet was designed by monsters who are trying to annoy us. And it should only be done to the extent that it helps. If it's not helping, then you can quit the trial. If it is helping, then you can try to do the detective work and figure out which parts of it you actually need to keep, and then you can jettison the parts that are not helping. So these are diets for some other common POTS comorbidities. The low FODMAP diet restricts foods that can be fermented by gut microbes, so it can sometimes help with small intestinal bacterial overgrowth or IBS. The criticism, though, is that you're also starving your beneficial gut microbes. The low fermentation diet is aimed to be kind of like a FODMAP light, so it aims to be easier to live with, easier to do. Let's see, on the joint hypermobility syndrome or EDS diet, if those people have achy joints, then just a general anti-inflammatory diet is encouraged. So, something like a Mediterranean type diet. The gastroparesis diet has no research behind it that I'm aware of, but involves avoiding fat and fiber since those are thought to slow stomach emptying. And some gastroparesis patients also have to do a liquid diet or a partial liquid diet. For dumping syndrome, where digestion is fast, it's the opposite. So more fat and fiber with no drinking water for 30 minutes after a meal, and maybe a pectin supplement to try to slow things down. For small fiber neuropathy, there are a bunch of supplements that might help, but one big dietary priority is to avoid chronic high blood sugar, because that is very well known to further damage small fiber nerves. ME/CFS does not have its own clear diet yet. There have been a number of studies, but unfortunately nothing has really emerged yet as being all that effective. And so I think the jury is still kind of out on that one. But people do generally try to kind of just do all the obvious things, like make sure gut health is good, make sure blood sugar is stable, eat anti-inflammatory. Sometimes they try to do an antiviral diet in case there's something like an Epstein-Barr or some kind of virus suspected underneath it. But the review articles that look at everything say that nothing has really emerged yet. So all of these diets might lend something to a POTS patient with these comorbidities. Most of them are based on expert suggestions more than any super hard evidence. Some are stronger than others. And a lot of people nowadays, unfortunately, find themselves doing more than one diet at once. Like maybe they have autoimmunity and SIBO, or maybe they have MCAS and gastroparesis. And so it can get really hard. So there's a website called whatthebleepcanieat.com, and my husband helped me make that for people who are on more than one diet at once. And you can go in and you can check off which diets you need to follow, and it will show you the foods that are compatible with multiple things at once. Of course, the idea is to eat the widest possible variety of foods that you can tolerate. We never want to be overly restrictive beyond what we absolutely have to. So, let's see. So, I would love to move on to another opportunity to maybe helping patients by finding some research findings from non-POTS populations dealing with common POTS symptoms. I'm not saying that these definitely apply to POTS. They haven't been tested on POTS yet, but I think they're worth a look. So I'd like to share some research findings relevant to 5 common POTS symptoms. So the first one has to do with helping to get more blood to the brain. We know that POTS patients don't always get enough, and that may contribute to the dizziness, lightheadedness, brain fog, and other symptoms that get worse when standing up. So it is well known in the nutrition world that elderly people have much faster cognitive decline if they lose their teeth and have to go on a soft food diet, because the act of chewing brings blood up to the head. So here's a study where they used fancy technology, PET scans, MRI, to measure blood flow to the brain when 12 subjects just sat there and then when they started chewing gum. And it was a gum chosen for being extra chewy. They found a 25 to 28% increase in blood flow to some regions of the brain, and their conclusion stated that, quote, chewing activates widespread regions of the brain, unquote. Other studies keep finding the same thing in different populations and using different measures of cognitive function or blood flow. So could this help POTSies get more blood to their brain? Could it help cognitive function in POTSies? I don't know, but a lot of POTS patients make a big smoothie to sip on all day, and that can really help them avoid big meals. But what if missing out on all that chewing is costing them blood flow to the brain? A really chewy snack like trail mix or carrots or apples or something could be an alternative to try. Or most people would benefit from just doing more chewing on the things that they're already eating, right? Plus, eating unprocessed foods has the benefit of requiring more chewing over processed foods, which generally just kind of melt in your mouth. So certainly something low risk that could be tried. I know several patients who swear by this, especially if they have to study. Next, pain. POTS can involve so much pain, like leg pain, abdominal pain, headaches, chest pain, nerve pain. Then if someone has joint hypermobility syndrome or autoimmunity, then they might have joint pain on top of that. MCAS has all kinds of weird pain, like burning pain, reflux. My least favorite is the stabbing itch that I get from MCAS. And there are over 1,200 studies in PubMed.gov on nutrition for pain. But just to take one really simple finding, vitamin C. It helps reduce inflammation, helps the brain make natural opioids, is super safe. It has been shown to reduce pain in cancer, in nerve pain during and after shingles, when recovering from surgery. It has helped chronic regional pain syndrome patients, which is exciting to me because I think that population has some overlap with POTS. It helps musculoskeletal pain and has been shown to make patients use significantly less pain medication in the hospital. So this review article just says, quote, vitamin C appears to be a safe and effective adjunctive therapy for acute and chronic pain relief in specific patient groups, unquote. So I personally just try to eat a lot of these foods shown here because I have a big appetite, but a supplement is also considered safe, and so maybe that's something to try. Moving on to mood. I don't know if you saw the two articles published by Standing Up to POTS president Dr. Kathy Peterson and me, but we found that 48% of POTS patients surveyed online scored at high suicide risk. So mental health might not get enough attention in POTS, and I do not pretend there's any nutrition solution for that, but this is an absolutely mind-blowing excerpt from a review of nutrition for mental health. And I was going to read the whole thing to you because it's so eloquent and amazing, but my husband said that would be audience abuse. So please read it on your own later, and I'm just going to summarize. Okay. So, I'm not going to tell you what FVI is for a moment, but here's the findings between FVI and mental health. FVI is associated with less depression, perceived stress, and negative mood states. It's associated with more happiness, positive mood, life satisfaction, socio-emotional flourishing, feelings of vigor, and mental health scores. This association between FVI and mental health is dose-dependent, meaning more FVI means better mental health. It is robust when controlling for all covariates. That means that they have made sure that it's not just education or wealth or fitness or sex or something like that that is accounting for the finding. And then this finding is also bolstered by longitudinal and interventional research. So they did say that a causal relationship has been established. So experts now largely agree that FVI causes mental health to improve. So what is this magical FVI? I bet you already had a guess. It's fruit and vegetable intake. And I know you're thinking, okay, fine, but what is the effect size that we're talking about here? Surely it's not going to be that impressive. So the effect size has been measured in large, well-done longitudinal studies. And in this study mentioned here, which is one of the biggest, most well-done, longest, it found that going from low to high vegetable intake groups across a period of 2 years resulted in significant life satisfaction, showing an average gain comparable to moving from unemployment to employment. So think about that for a second, right? That's a really big effect size. When was the last time you were unemployed? Maybe it's been a while, but think about the life satisfaction you get moving from unemployment to employment. So anyway, that's an enormous effect size. And other studies find similar things. And they've picked apart mood-causing food choices versus food choices driving mood. And it does go both directions, but fruit and vegetable intake does appear to directly drive huge improvements in mental health. And the more we learn about the gut microbiome and about brain inflammation, I don't even think this is really that surprising anymore. But I think what's surprising is how little we talk about this. So anyway, that's why I propose the next POTS nutrition meme or t-shirt to look something like this. It really bugs me that nobody gets paid to publicize findings like this. And so I think that is kind of part of our job. I also think that for patients whose POTS makes it harder to buy or prepare or digest fruits or vegetables, I think we need to help them overcome those barriers. I see tons of people who are almost happy to write off fruits and vegetables because they're not as tasty. And so they might say, oh, my digestion doesn't really work with those, or they're just too hard to get, so they're not for me. I'll just be happy living on meat and bread. And often it's because fruit and veggies do cause bloating or gas or reflux, and this is not just in POTS patients. But I really think people should work hard to be able to get and eat and digest fruits and veggies and not give up on that unless they really, truly have to. Even if they have to boil or peel or skin or juice the veggies, I think that could be a bigger priority for everyone. But one more good mood item that isn't salad. We have reason to enjoy dark chocolate. Most studies on chronic fatigue have failed to find much that helps, but a really well-done, double-blind, placebo-controlled crossover study was done where they took people with chronic fatigue and gave them either real dark chocolate or white chocolate that was dyed to look dark, but it did not have any actual cocoa in it. And they gave everyone a real or placebo chocolate bar every day for a few weeks, then switched them to the other formulation for a few weeks, then switched them back to the original formula for a few weeks, and had subjects rate their fatigue and quality of life the entire time. And the results were really clear that the real chocolate with real cocoa consistently helped. So hooray for chocolate. And if you don't want to do the sugar, you could just do cocoa nibs or cocoa powder and add that to things like yogurt or fruit or smoothies or whatever. And finally, a last example. studies keep replicating some pretty cool findings about dietary nitrates and their ability to improve exercise tolerance and cognitive function in several different populations. This has been done in over 50 or 60 different studies. I just chose 3 to show, but the studies follow the same method. Subjects are given some nitrate-rich juice or a placebo, and they drink 2 cups a day for 5 or 6 days in a row. On day 7, they come in for an exercise test. It's been done on healthy people cycling at high and low intensities. It's been done on hypoxic COPD patients who could not walk very far. It's been done on patients with peripheral artery disease who could barely walk, and a few other populations doing various different exercise tests. And each subject does this twice, about 1 month apart. Once where they drank the nitrate-rich juice and once with a placebo. Then they compare exercise performance, and here's what they found. In a study with 8 patients with COPD, they found a 14.6% increase in the amount of distance walked when they drank the juice with real nitrates for 5 days. In 8 patients with peripheral artery disease, the patients who drank the real juice for 5 days were able to walk 18% farther. In 8 healthy men made to do a specified rate of cycling, they found that after the nitrate juice, the men were using 19% less oxygen to do the exact same amount of work. Then they were made to do a very fast pace, and their time to exhaustion was measured. And on the nitrate-rich juice, they lasted on average 16% longer. With a different exercise, this time it was a quadriceps exercise called knee extensions, they saw something similar. This was on middle-aged men who were recreationally active. And 8 of the 12 subjects were better after the real nitrates, with a mean improvement of over 30%. Right? So think about that. In just 5 days of drinking 2 cups of a certain juice, they had a 30% increase in their ability to exercise before they got exhausted. So what is it? Where do these crazy nitrates come from? What foods? It's just beets or greens or lettuce or broccoli or a few other vegetables. The studies all used beet juice because they could easily make a placebo version, but arugula is among the highest in nitrates, so I like to just throw a couple handfuls of pre-washed arugula into like scrambled eggs, and it wilts into almost nothing. I like to do that when cross-country ski season starts. As a POTS patient, I worked many years to be able to cross-country ski again, and I do attribute some of being able to do it to dietary nitrates. So that was a consistent 15 to 30% increase in exercise tolerance in just 5 or 6 days. And that's because dietary nitrates from vegetables are shown to do some pretty cool things. They increase oxygen delivery to tissues, especially hypoxic tissues. That excites me. They selectively deliver oxygen to hypoxic tissues. Dietary nitrates decrease the oxygen cost of exercise through creation of more ATP made per oxygen molecule. So that means even if you are not able to get more oxygen into your blood, you can do more exercise. Nitrates also improve muscle contracting efficiency via calcium ion metabolism. And in one study, they improved cognitive performance at rest and during exercise via oxygen delivery in hypoxic areas of the brain. So, all this potential upside from eating foods that will, as a side effect, just cut your cancer risk and stabilize your blood sugar and feed your gut microbes and lower inflammation anyways. I mean, it kind of seems too good to be true. Now, does this definitely apply to POTS? I don't know, and we're not likely to get any studies in POTS patients anytime soon. But in my mind, it doesn't really matter anyways, because nutrition research only says how most people react most of the time anyways. So in the end, we all have to try it for ourselves. But we got to eat, right? And so I feel like I'm a fan of doing these things that are safe and cheap and maybe worth a try. So those are just a few examples of POTS symptoms that I think about when I'm reading the POTS literature. So back to this combinatorial explosion of issues that can create nutrition needs, challenges, and logistical barriers. I hope it came through that I think that POTS literally is the most complex patient population I've seen in 25 years, but that the large number of issues creates almost endless opportunities to hopefully help someone find a dietary routine or hack that helps them feel better. Even if it's just that 5 to 10% better, that can be applied to the pursuit of the next 5 to 10% improvement. That's how I see a lot of patients improve. So that's all I've got. For deeper dives on nutrition for POTS or all kinds of POTS topics, we have a nonprofit called Standing Up to POTS. We've funded over $300,000 in POTS studies, prioritizing studies that can help today's suffering POTS patients. And our new podcast got its first 100,000 listeners so fast that we were shocked and realized there's a huge hunger for this information. So I invite any of you, if you have information that you think would help patients or caregivers, maybe a new finding or an area of expertise, I'd love to have you as a guest. I always send my questions ahead of time for your approval so that it's low stress and no surprises. But we're trying to make the best POTS info accessible to everybody because POTS specialists are getting expensive or difficult to access, and we're worried about everybody having access to it. So that's it. Thank you for listening, and I'm excited to hear your thoughts on POTS nutrition. Thank you.